record. Okay. So today our topic of lecture is burn. Very important lecture, and many MCQs are coming out from the burn topic. So you must have to understand what is burn, what is the classification of burn, and how you are going to manage the burn, what can be the complications of the burn when you are going to intubate the patient. So very important topic. So please listen this lecture and write down all the important things in relation to the lecture. Okay. So first of all, we will start from the layers of the skin. So see here, everyone. Whenever we are studying the skin we are going to divide into the most outer layer. The most outer layer of the skin, it is known as the epidermis. The second layer of the skin, it is known as the dermis. The third layer of the skin, which consists of subcutaneous fat, it is the third layer of the skin. Okay. And under the subcutaneous fat here, you have the muscles, and along with the muscles, you have the bones also. Okay. So you have to understand these layers of the skin. So see here, the epidermis, it is the most outer layer of the skin. And this most outer layer of the skin, it further divided into 5 layers: stratum corneum, lucidum, granulosum, spinosum, and basale. Dermis layer, which is the second layer of the skin, it is second layer of the skin. It is further divided into the papillary layer, and it is further divided into the reticular layer. And then we have the subcutaneous fat. The subcutaneous fatty layer, it is also known as hypodermis. It is also known as hypodermis. Okay. So this is also known as hypodermis. So you must have to know the layers of the skin. For example, when we are going to study the classification of the burn, if the burn is only involving the epidermis, it is known as first degree burn. So first degree burn is what? It is only involving the epidermis. So this is your first degree burn. If the burn is involving epidermis plus dermis, it is known as second degree burn. If the burn is involving epidermis plus dermis and hypodermis, it is known as third degree burn. Third degree burn. And if the burn is involving epidermis, dermis, hypodermis, and also the muscles and the bones, it is known as fourth degree burn. Okay. So that's why these layers of the skins are important. So if you remember these layers, you can easily understand that if the burn is only involving the outer layer, it is known as first degree burn. If the burn is involving the epidermis and the dermis, so 2 layers are involved, so it is second degree burn. If it is involving epidermis, dermis, and hypodermis, it is known as your third degree burn. And if it is involving the all the 3 layers of the skin along with the muscles and sometimes bones also, it is your fourth degree burn. So you must have to understand these layers. Okay. So now we are to study the functions of the skin. So please remember skin. Number 1 point, what you must have to remember, that this is the largest organ of your body. So the largest organ of your body, it is your skin. And this skin, please remember, it is your first defense barrier. It is protecting you from the environmental hazards. It is protecting you from the trauma, from the radiations, from the microorganism. Okay. So see here, what are the functions of the skin? Number 1, it is going to regulate the body temperature. Second, it will protect you from dehydration and infection. So please remember, skin will not allow the water to evaporate it. So it will protect you from dehydration. But if the skin is damaged due to the burn injury, there can be dehydration, there can be formation or result of infection in the patient. So please remember, your skin is making a barrier to the environment. So when it is making a barrier to the environment, please remember it is protecting you from. It is protecting you from what? It is protecting you from trauma. It is protecting you from various type of radiations. Okay. It is also protecting you from various types of microorganisms or pathogens. Okay. So it is protecting you from all these things. So how it is going to protect? Your skin is going to form the sweat. Sweat plus sebum. So there will be formation or there will be secretion of sebum. There will be formation of sweat. And now these two secretions are going to mix together. So when they are going to mix together, they are going to form a acidic film on your skin. They are going to form a thin, you can say, acidic film on your skin. And this acidic film which is formed on your skin, it is going to protect you from various microorganisms. It is also going to protect you from various toxic substances also. Okay. So this is how your skin is protecting you. Okay. It is also regulating your body temperature. It is also regulating the, you can say, the water homeostasis. Okay. Water homeostasis. So if the skin is damaged, there will be formation of dehydration. If the skin is damaged, there will be more chances of infection in the patient. So very important point. When we are going to discuss about the complications of the burn patient, please remember complications of the burn patient due to dehydration, patient can develop hypovolemic shock in the patient. So hypovolemic shock uh, can result in a patient with severe burn injury. So if the burn injury or the burn surface area is more than 15 or 20%, in these patients, you must have to give the patient large amount of IV fluids. Please remember, in the first 12 to 24 hours after the burn injury, when the patient burn surface area is 15 or 20%, you must have to give him large amount of IV fluids. Why you are giving large amount of IV fluids? Because within 12 to 24 hours, patient can develop hypovolemic shock. So you don't want your patient to develop hypovolemic shock. So you must have to give what? Large amount of IV fluids to the patient. This is the first point which you must have to remember. Second important point, that in patients with burn injury, because your skin is protecting you from various type of infections. So if the skin is damaged due to the burn injury, patient can lead to sepsis also. Patient can again lead to the sepsis also. So two important MCQs which you must have to remember here. Number one, write down everyone. Most common cause of early death in burns. Early death in burn patients, the answer again is hypovolemic shock. Hypovolemic shock. So that's why you are going to give large amount of IV fluids to the patient. Number one point which you must have to remember. Second point. Second point. Most common cause of late death in burn patients, answer is sepsis. This is the second MCQ which you must have to remember. And if I going to ask you what is the overall most common cause of death in patients due to burn injury, answer is again sepsis. Okay. And please remember this sepsis which is going to be occur in a patient because of the infection, the microorganism which is going to involve in the patient, your answer will be Pseudomonas infection. Very, very important MCQ which you must have to remember it forever. Okay. So write down everyone. Most common organism which is responsible for infection and sepsis in patients with burn injury, your answer will be Pseudomonas. So how you are going to know that patient develops Pseudomonas infection? See here everyone. In your wound, there will be greenish discharge. So please remember it forever, all students who are listening to me, that if in a wound of a patient there is a greenish discharge, the infection or microorganism which is causing the infection, answer is Pseudomonas. So whenever there is a greenish discharge, this is Pseudomonas. And the most common organism which is causing infection or sepsis in patients with infection and sepsis in patient with burn injury, again the answer is Pseudomonas. So if I am going to give you any type of wound in which I write that from the wound there is a greenish discharge, your answer will be, sir, this is a Pseudomonas infection. This is a Pseudomonas infection. Clear to everyone? So very important MCQ, you must have to remember it. Okay? So after this, from the function, now coming into the introduction of the burn. So what is burn? Burn is a coagulative destruction of the surface layers of the body. So in burn patient, there is a formation of coagulative necrosis. So due to the burn injury, the blood vessels in the skin, in the layers of the skin are going to be compromised or going to be damaged. And when the blood supply is compromised, the patient will develop coagulative necrosis in the patient. It occurs, see here, it occurs due to the heat, due to the cold injury. Cold injury result in frostbite, electricity, which is more common in adults. Okay, more common in adults, radiations, lightning, and chemicals. Chemicals, I already explained to you, whenever there is any chemical injury, you are not going to neutralize it. Not going to neutralize it. You have to wash it with water. Wash it with water. And you are going to use which water? Tap water. You are not going to use cold water. The water temperature must be 15 degrees Celsius. Okay. So you have to wash the wound with large amount of water, and the temperature of the water must be at room temperature. So it must be at room temperature. Okay. Because if you are going to use cold water, or if you place ice water and use ice water, it will further damage the skin of the patient. You are going to use room temperature water, 15 degrees Celsius water. Okay. So these are some of the causes of the burn injury patient which you must have to remember. So see here everyone, what are the causes of burn injury? So burn in children, it is mostly the scalds. What is scalds? Scalds are caused by accident with kettles, pans, hot drinks and bath water. तो आप लोग क्या करते हैं, पानी वगैरह रख देते हो गर्म करने के लिए और बच्चा आता है उसको अपने ऊपर गिरा देते हैं. So it will result in scalds. So scalds are more common in children. Scalds are more common in children. In adults, scalds are uncommon. In adults, most common is your chemical and electrical injuries. So most common it is electrical and chemical injuries. Cold and radiations are rare. So now coming into these injuries now. See here. It can be thermal injuries, dry heat, contact burn, or injury from the flames. Moist heat, that is the scald injuries, which is most commonly in the children. But important here is the smoke and inhalational injury. Very, very important point which you must have to remember. So please, one very important point which you must have to remember, that whenever there is a burn injury to the airways, write down this point all students. Whenever there burn injuries to the airway of the patient, okay, what you are going to do in this patient? You have to perform intubate this patient as early as possible. Because if you are not going to intubate this patient as early as possible, patient will develop laryngeal edema. विरुचन लिखो, विरुचन एंड कंपनी लिखो. सारे इधर गप्पे मार रहे हैं. विरुचन एंड कंपनी. विरुचन एंड कंपनी लिखो बैठ के. गप्पे मार रहे हैं सारे.
लिख लिख रहा हूँ सर, लिख रहे हैं
लिख
सर।
रहा हूँ. मुझे पता है जो तू लिख रहा है. मैं चेक करूंगा तुम तीनों के नोट्स. So please see here everyone. If the patient burn injuries involving the airway and you are suspecting that patient airway is burned, how you are going to know? There will be burn injury to head neck region, head and neck region, burn injury to the face. Okay, the nasal air will be burned. Nasal air of the patient will be burned. There will be hoarseness of the voice. Hoarseness of the voice. There will be development of stridors in the patient. Okay. So whenever there is a history of, see here, burn to the airway, how you are going to know? The burn is going to involve the head, neck and face region. There will be the nasal, the nasal hair will be burnt. Okay. And there will be hoarseness of voice. There will be stridor. There will be carbonaceous deposit in the sputum. Okay, carbonaceous deposits in the sputum. So all these things are telling to you that the airway of the patient is burned. So when the airway of the patient is burned, it is better for you to intubate the patient. Intubate the patient as early as possible. Because if you are not going to intubate the patient, patient will develop laryngeal edema. And if the patient develop laryngeal edema, it is very difficult to intubate. So you will go for what? Cricothyrotomy in the patient. You will go for cricothyrotomy in the patient. So if I give you a patient with airway burn injuries, you must have to intubate this patient as early as possible. Okay. Because if you are not going to intubate, patient will develop difficulty in breathing due to laryngeal edema. So now this patient, you can only perform cricothyrotomy. Okay. So this is very important point which you must have to remember. Second important point, inhalational injuries can also lead to metabolic poisoning also. Metabolic poisoning. So what is metabolic poisoning? Whenever there are flames in a closed area, in a closed room, for example, what is going to happen? There will be release of carbon monoxide. And due to that release of carbon monoxide, patient can develop carbon monoxide poisoning. Carbon monoxide poisoning. So whenever there is carbon monoxide poisoning, they can give you that the patient carbon monoxide can be released from motor exhaust. Carbon monoxide can be released from gas heaters. And carbon monoxide can be from your fire victims also. Okay. So these are the three, you can say, exposure of the carbon monoxide. So what carbon monoxide is going to do now? Carbon monoxide is going to attach with your hemoglobin. It is going to bind with your hemoglobin and it has the affinity of 200 to 250 times more affinity to hemoglobin as compared to oxygen. So it is going to attach with the hemoglobin or bind with the hemoglobin because carbon monoxide is have affinity of 200 to 250 times more to attach with the hemoglobin. So it is going to form carboxyhemoglobin. Carboxyhemoglobin. So this carboxyhemoglobin, it is not going to give oxygen to the cells. So oxygen to the cells is compromised now. So what is carbon monoxide doing in the patient? See here everyone. Carbon monoxide poisoning, it is going to inhibit your aerobic metabolism. Inhibit your aerobic metabolism. And when it is going to inhibit your aerobic metabolism, it is going to inhibit aerobic metabolism in the mitochondria. In the mitochondria. And then it is going to inhibit your mitochondria via an enzyme. What is the name of the enzyme? The name of the enzyme is cytochrome C oxidase. So it is going to inhibit this enzyme. So when it is going to inhibit this enzyme, it is going to block your electron transport channel, ETC. Electron transport channel is going to be blocked. So when electron transport channel is going to be blocked, patient cannot breathe properly and patient will die. Because CO poisoning, please remember very important point, it is a odorless gas. And whenever they give you a scenario of carbon monoxide poisoning, there will always be multiple victims involved. एक बंदे की डेथ नहीं होगी, multiple victims involved. For example, if Pakistani students are listening to me, I think 2 years back in a Murray, there was a heavy snowfall, and due to that heavy snowfall, all people are visiting the Murray. And when all people are visiting the Murray, the motor exhaust was blocked by the snow. And when the motor exhaust was blocked by the snow, all the carbon monoxide was entering into the car. And the people who are sitting in the car all are dead in the morning. It was happened about 2 years ago back in Pakistan in Murray. So please remember, this is a patient of carbon monoxide poisoning. And because it is a odorless gas, patient is not going to feel anything. Patient will start developing headache. Patient will start developing confusion, visual disturbances. And what you are going to find on the patient, you are going to find cherry red skin of the patient. Okay, cherry red skin and sometime with bullas also on the patient. So this is a patient of carbon monoxide poisoning. So what you are going to do? So patient with carbon monoxide poisoning, you have to give them what? 100% oxygen to the patient. 100% oxygen, and if the patient is severe, you will go for hyperbaric oxygen. Oxygen under high pressure, hyperbaric oxygen. So this is the management of carbon monoxide poisoning. But sometimes what happens, patient can develop cyanide poisoning also. Cyanide is present in your paints. Okay. So when there is any fire victims, patient can develop cyanide poisoning also. And for management of cyanide poisoning, what you are going to do? You are going to give him hydroxycobalamin. Hydroxycobalamin. So please remember, cyanide poisoning, management is hydroxycobalamin. Carbon monoxide poisoning, management is 100% oxygen or hyperbaric oxygen. This is your MCQ. This is also your MCQ. Please remember it forever. Okay. So now coming into the next slide now. Now coming into the pathophysiology of the burn. So see here, what is happening in patient with burn injury. So burn injury patient, when the burn injury is severe, whenever I am writing severe, it means the burn injury is more or burn surface area is more than 15 or 20%. So when the burn surface area is more than 15 or 20%, what is going to happen? There will be severe inflammatory reaction in the patient. And due to that severe inflammatory reaction, there will be release of inflammatory mediators in the form of cytokines. These cytokines are doing what? They are going to increase the vascular permeability of the patient. Due to that vascular permeability of the patient, there will be vasodilation. And due to that vasodilation, the liquid part of the fluid or liquid part of the blood, it will move from intravascular compartment to the extravascular compartment. It will lead to edema in the patient. It will lead to reduced intravascular volume in the patient. And when there is decrease in the intravascular volume, the blood viscosity will be increased. There will be increase in the hematocrit level. So very, very important MCQ which you all must have to remember that in patients with burn injury, there will be false increase of hemoglobin. So in patient with burn injury, there will be false increase of hemoglobin. So false increase of hemoglobin you are going to see in patient with burn injuries. Okay. So now due to this, the volume of fluid is lost now, which is directly proportional to the area of the burn. Okay. So fluid is lost from the blood vessels also. Fluid is also losing from the skin also in the form of evaporation. So now the patient will develop a shock, and the shock which is patient is going to develop is the hypovolemic shock. So please remember all the patients with burn injuries, when the burn surface area is 15 or more than 15% or more than 20%, the patient will develop hypovolemic shock. So please remember in early stages of burn patient, if the burn surface area is 15 or more than 15 or 20%, I must have to give the patient large amount of IV fluids. So I must have to give large amount of IV fluids to the patient. So large amount of IV fluids, please remember, you must have to give to the patient so that the patient cannot develop hypovolemic shock. Okay. So this is the pathophysiology of the burn. And one more important point, that in patients with burn injury, they can develop curling ulcers. Two ulcers you must have to remember. One is the curling ulcer. Second is the Cushing ulcer. Burn UR is present. So UR is present. So UR is present in curling. So you can understand that patient with burn injury can results in a formation of curling ulcers. But now the curling ulcers are rare because immediately after the burn injury patient, we give the patient proton pump inhibitors. So when you are using proton pump inhibitors, there will be less risk of forming of the curling ulcers. So how the curling ulcers are forming in the stomach of patient with burn injury. So listen now. Due to decrease in the intravascular volume, due to decrease in the blood volume, there will be decreased mucosal secretions in the patient. And due to that decreased mucosal secretions in the patient, the normal HCl will now damage the mucosa. And when the normal HCl will damage the mucosa of the stomach, the patient with burn injury is going to develop curling ulcers. So this is how the curling ulcers are formed in patient with burn injury. Second, what is Cushing ulcer? So patient with Cushing ulcers, please remember, there you are going to see in patients with head trauma or raised intracranial pressure. So head trauma or raised intracranial pressure, it will lead to the activation of your vagus nerve. And when the vagus nerve is going to be stimulated with head trauma patients, what is going to happen? That this patient HCl secretion will be increased. Okay. So HCl secretion will be increased due to the stimulation of which nerve? Vagus nerve. And not due to increased HCl secretion, patient will develop Cushing ulcer. So see here, burn patient, the HCl secretion is normal, but mucosal secretions are decreased. That's why patient is developed curling ulcer. Head trauma patient, due to head trauma, there is activation of the 10th cranial nerve, that is your vagus nerve, and it is going to increase the HCl secretion. So increase HCl secretion, there will be formation of Cushing ulcers in patient with head trauma. So you must have to remember what is a Cushing ulcer and what is a curling ulcer. So burn, see here, burn, UR. UR is present in curling ulcer. So you can never make a mistake that burn, it is going to form which ulcer? Answer is the curling ulcer. Head trauma, it is going to make Cushing ulcers in the patient. After head trauma, you have Cushing's triad. Cushing triad show you that patient is having increased intracranial pressure. So Cushing triad will lead to Cushing ulcers. Okay, so this is how you can remember it. Okay, so this is the pathophysiology of the burn. Okay, now coming into the zones of burn injury. Very, very important. So whenever the area of the patient is burned, listen very carefully. This area, which is the most inner area, see here everyone, which I am highlighting in the red color. This is the zone of coagulation. This is the most inner zone of burn injury. And this inner zone, there is a coagulative necrosis. The blood vessels are ruptured, damaged. There is no blood supply to this area. Cells are dead. Necrosis. Necrosis, it means it is irreversible cell death injury. Irreversible cell death injury. Cell death injury. Okay. So this most inner area, it is known as zone of coagulation. Okay. This is known as zone of coagulation. Second, around the area of the zone of coagulation, this green area, which I am highlighting in green color, this is known as zone of stasis. So area surrounding the zone of coagulation, it is your zone of stasis. So please remember here the blood flow is less, inflammation is less. So in this area, cells can survive. Cells can survive if you give proper help to the patient. If you are not going to give proper help to the patient, these cells can also progress to coagulative necrosis. So what you are going to do? You have to wash it with tap water, not cold water. So because if you are going to use here cold water or water with ice, the blood supply to this area is already less. It will become vasoconstriction and less blood will be here. So it will go into the zone of coagulation and it will progress to coagulative necrosis. Okay. So that's why you are always using tap water or water at room temperature, that is 15 degrees Celsius. And now the most outer one is your zone of hyperemia. This is the area which is completely, you can say, is having good blood supply. It is not damaged. So this is your peripheral area of the burn injury. Least cellular injury, high blood flow. So this area will completely recover. Okay. So these are your